From WFRB TV Local 5, your local election headquarters, this is Newsmaker Sunday with your host, Tom Zaleski.
Good morning and welcome to Newsmaker Sunday. I'm Tom Zaleski. Northeast Wisconsin continues to deal with the impact of the coronavirus pandemic. And joining us this morning to discuss the medical questions surrounding COVID-19 is Dr. Raul Mendoza, a pulmonology critical care medicine specialist with Aurora Healthcare. He has been here on Local 5 in the past with some information for us. Doctor, thank you so much for joining us once again this morning.
Thank you so much, Tom. Thank you for the invitation.
Doctor, I have noticed in the past couple of weeks, maybe 3 weeks, you have done a lot of posting of good information on Facebook, not only for people here in Northeast Wisconsin, but also for your friends and family back home in Mexico. And while the information has been good and solid, I notice you seem to have a calming effect to your message. Was that your intention?
Yes, but not because I want to calm people and just try to sugarcoat. I want to have a balance between the reality of what is happening and for people to be aware of how serious this condition is. But at the same time, I just want to paint the reality of what is happening, particularly in northeastern Wisconsin. We are not New York. We are not Detroit. We are in northeastern Wisconsin, and our governor has taken this matter very seriously from the outset. And all these measures that have been implemented have worked really well. We are lucky to live in a place where we have integrated healthcare systems. I'm part of one of them, and then there's a concerted effort and organization, not only within our hospital system, but also across the systems. We're talking to each other. So we have been able to buy time, and I want to convey that message that, we are, as long as we stay united and as long as we follow the advice of the healthcare authorities, we are going to be in better place than others. Still, we have a long road ahead, but I just want to maintain this sense of hope and union. And I just hope that my positive message permeates across the region, hopefully throughout the state. And then, just because this is a long road and we need to maintain people informed, and you guys are doing a great job on this. And so it's part of my duty as a collective level. When I sit down with my patients, probably I invest 5 or 10 minutes on listening to the heart and to the lungs and checking on things. But a substantial portion of my interview with a patient at an individual level is to explain, to carry, to show them, because I know information. I know, but I need to translate that information. And always you have to do it in a way that is easy to understand, but also you have to convey a sense of that what you are doing, and that's probably what I'm trying to do at a collective level. I'm trying to.
You talked about painting the picture for Northeast Wisconsin. I know you're not a fortune teller, but when do you think that we here in Northeast Wisconsin will reach the peak of this pandemic?
Well, I am trying to use multiple predictors, and of course, what I say is just one of the many models that we are having. I'm based on the Murray model from University of Washington, and everyone has access. It's public knowledge, and he has done calculations about when, and then we're estimated that sometime in mid to late April, in the next few weeks, we're going to see the biggest use of resources in Wisconsin. And we have to understand when I say that, within Wisconsin there will be regional variations. Maybe Milwaukee will be busier before we get busy, and that will affect us in a way because we all are part of the same resources. The lab testing for the state will be busier. But in the next couple of weeks, we're going to see, assuming that we continue to do what we're doing, all the practice that you have been and informing to the people. Practice the social isolation, hand washing, cover your face, and all the things that we've been telling again and again and again. And we have to be patient, but it seems that it's working.
Doctor, a lot of people at this time of the year just plain and simple don't feel very good. But at what point should they contact their doctor?
Yes, I think we all have symptoms on a daily basis, and we're paying a lot of attention to them. But if you have fever, if you have a cough that is worsening, and if you have shortness of breath, those are the three things that I will recommend either to call the 1-800 line that we have in all institutions to do a triage, or contact your doctor's office. Shortness of breath, fever, or worsening cough.
And as you well know, we're entering into hay fever season right now, allergy season right now. How do you know the difference between an allergy, a hay fever, and COVID?
Yeah, well, at the very, very, very beginning, it is difficult to know. At the very beginning, you may have some sore throat and some sneeze, but definitely body aching doesn't come with body aching doesn't come with hay fever only. So if you have your body, your joints are aching, your muscles are aching, and if you have fever and night sweats, that doesn't go along with hay fever. That will be one of the key things. And then if you have asthma, you can have shortness of breath, but other than that, progressive shortness of breath will be one thing that I will distinguish between hay fever symptoms and COVID symptoms.
We often hear about these underlying conditions that some people who have passed are experiencing or have experienced. What are the underlying conditions that you look for?
Yes. Diabetes that is not well controlled, kidney disease, of course, underlying lung conditions like COPD, emphysema, asthma, and high blood pressure that is not well controlled, congestive heart failure, and if you are under the effect of any immune suppressant medication.
All right. Now, we've been hearing about not only people who are immunized compromised, but also the elderly. Now, what about people who are over 60 years old and they're in good health? And I'm going to put myself in that category right now. Should I do things like go to the grocery store? Am I okay doing that?
If you don't have any other resource and you don't have, the recommendation will be no, try not to. But if you have no other choice because your family is not around or your friends are not around, then yes, do it, but practice all the good hygiene. First, it's important everyone that goes to places, grocery store, pharmacies, it is the best way is just to wear a mask. And we have to work for the next few months under the assumption that every other person that we see is a potential carrier for this, is an infection source. So the mask will not protect you. It will protect others in case you are an asymptomatic carrier. But if everyone wears a mask, then the potential for infection and cross-infection will decrease. Hand washing, frequent hand washing, don't touch objects, carry your sanitizer, and the physical distance of at least 6 feet from each other, regardless of the mask, regardless of everything. If you go to the grocery store, you see someone at the aisle, wait until they finish whatever they're doing before you move and then do or whatever. And the same if you're at a park, the same. But if you're over 65, that's what you need to do. Practice the same thing.
All right, good advice for my Saturday shopping. We shall continue with Dr. Raul Mendoza right after this, so please stay with us.